Hi everyone, welcome to researchmd.com. We got another great presentation today. Today we're going to look at the side effects and complication of ketogenic diet. So we made a previous video about what is ketogenic diet. So we're going to look into deep, and today we're going to look at what is there any complication, what are the side effects of ketogenic diet. Again, my name is Pramil. Cheriyath. I'm a program director, internal medicine transitional residency. I teach medical students and residents. I'm also director of research and assistant professor of medicine to major medical schools. So some interesting fact of ketogenic, a lot of attention now these days, right? Everybody wanted to try ketogenic diet because of the benefit. He was actually started in 1921 to a pharmacological treatment for the people with the refractory epilepsy. Okay, and then later on, before there was an insulin, they were trying this to treat diabetes. Okay, mechanism because the people were losing a lot of weight. Insulin inhibit the fat breakdown of the fat in the adipose tissue. So what are the components of ketogenic diet? There's like protein, 1 gram per pound of body weight per day. Carbohydrate restriction, right? Carbohydrate no more than 20 grams total per day, and remaining caloric need comes from the fat. Typically fats could be medium or medium chain triglyceride. Now, if you look at the ketone metabolism, it's different than the carbohydrate metabolism, what we are pretty much used to, the normal. So on this slide, we have the left side of the carbohydrate. There is glycolysis and the energy breakdown going into the Krebs cycle, ATP formation, right? Let's see what happened in the ketogenic diet. You got the fat is converted into fatty acid and glycerol, beta oxidation. Then it comes to the Krebs cycle. And also in the proteins kind of breaking down into amino acid transamination, and then it comes to the Krebs cycle and energy production. Those are the main difference, okay? Ketones like ketone bodies like acetone, acetoacetate, beta hydroxybutyrate, they're like formed in the liver from the fatty acid oxidation. Even during the period of low carbohydrate availability, important fuel source during starvation. Even when we sleep, we don't eat for a while, that ketone production can happen. So let's get into our topic today. What are the side effects? Number one, dehydration can cause dehydration. Ketone bodies can cause like frequent urination treatment. You drink in plenty of water. Transient hypoglycemia can occur in the initial period. Acute caloric restriction along with the ketones stimulate insulin secretion. Only the initial, when the body, so that's very important to start very slow. Let the body get accustomed to, okay? And now, halitosis, bad breath, the fruit smell, typical feature of ketosis, acetone, hepatic alcohol dehydrogens converted into isopropanol. So you can have a false positive alcohol breath test. Now, the other thing, the gastrointestinal side effects can have like nausea, vomiting, high fat content delays the gastric emptying, diarrhea, defective absorption of intolerance to fat, constipation, low fiber, low volume intake, and all these symptoms, initial stages, but as the body gets used to it, you should see a big difference. Hyperuricemia, because uric acid level increase if the diet has low carbohydrates, right? So lipid changes, very important lipid profile changes, right? Plasma triglyceride decreases. LDL cholesterol increases in the early stages due to the high lipid intake. And then rare side effects are like hyperproteinemia, hypocalcemia with the bone damage, urolithiasis, gallstones, and hair loss. These are like very rare side effects, okay? Thank you so much for watching. We'll be back with another presentation soon. Please subscribe to our channel. Thank you.